You all must have heard the term LASIK. What is LASIK? LASIK is a laser refractive procedure to get rid of your glasses. Is that the only procedure, and what are the different types of laser procedures is what we are going to be discussing today. Hi, I'm Dr. Poojita from Pixel Eye Hospital. Now, laser refractive surgery is a broad-based name given to any of those laser procedures which are done to get rid of your glasses. Of course, there are a lot of subcategories and a lot of different names. We'll come to that later. But what are the three broad categories for getting rid of your glasses? That the basic principle that is followed in all these procedures to remove your glass power is pretty much common. All these procedures are reshaping your cornea in different methods, but they are all reshaping your cornea, and hence your power is getting corrected. Now, the first procedure is called as PRK. Now, in PRK, there is a top layer of the cornea which is called as epithelium. That epithelium is peeled off. The peeling off of the epithelium can happen in two ways. One, manually removed, or second, removed using a laser. After that epithelium has been peeled off, the reshaping of the cornea happens again with the laser. This is where your power correction actually happens. After the surgery, a bandage lens is placed on the cornea, and this epithelium that we have peeled out starts to grow back again in a matter of 3 to 4 days. The surgery time is hardly about 3 minutes to 5 minutes based on different machines. The details of what to expect in the procedure, what to expect after the procedure, what are the benefits, the risks and all that, we are going to make individual videos subsequently. The second procedure is the most popular word called as the LASIK. LASIK was very popular many years ago and it is still widely used. In this procedure, a flap is cut on the cornea. Now, the flap can be cut in two ways. It is either done with a very sophisticated blade, or it is also done with a laser. After the flap is cut, it is lifted off the cornea, and the reshaping of the cornea, like in PRK, is done with a laser. The flap that has been lifted is put back and closed. The putting back and closing doesn't happen with some sutures or glue or anything. It naturally attaches, and it attaches very strongly over a period of time. The procedure time is also very similar to PRK, about 3 to 5 minutes for each eye. The third procedure is called as SMILE, Small Incision Lenticule Extraction. What that means is a small amount of tissue is removed from the eye. Now, none of the other procedures had any tissue removal. They were just reshaping it directly with the laser. In this, a tissue is removed from the eye. In this procedure, there is a small 2 to 4 millimeter cut that is made on the cornea. It's a very small cut, and the amount of tissue that needs to be removed to correct your power is cut again using a femtosecond laser. After the cut has been made, we separate it from the tissues that are surrounding it, and then we remove that tissue outside. Now, the amount of tissue that is removed and the thickness of the tissue that is removed will depend on the power that you have. The lesser amount of tissue is removed if you have a less power, more amount of tissue is removed if you have a more power. And there is no closure, it is just removed and the surgery is done. Now, this procedure also takes about roughly 5 minutes per each eye. These are the three broad categories. In the subsequent videos, we are going to be talking individually about each of these procedures, and stay tuned for more such content.